Joining us in studio, you can listen in both at your favorite SuperTalk station, streaming live online at supertalk.fm, and you can watch it for yourself on SuperTalk TV. Go to supertalk.fm/watch, and you can see it for yourself. Joining me in the studio now, President and CEO of the Mississippi Hospital Association, Tim Moore. Tim, thanks for joining us, man. How you doing today?
Oh, doing good, Dave. Thanks for having me. It's always a pleasure.
Always a pleasure to talk to you, and we've got something to talk about, and I was just talking about it before the news.
Yes, you were.
We've been talking about it a lot this week because we're building up to Election Day next Tuesday, and that's Initiative 65 and 65A. And right off the top, I'm going to give you the chance to reiterate, just in your own words, Initiative 65, what's your opinion?
You know, Dave, let me say this first, and that's my opinion on medical marijuana. And there is legitimate reasons for medical marijuana, and there are patients that need access to that. I think there's a lot of patients that don't realize there is access in some form now that they probably need to look at first. I've said from very first start that I was supportive of medical marijuana for the right patients under the right controlled conditions. I don't think we see that in 65A, and that's my biggest concern.
Or 65, you mean?
I mean 65. 65, yeah. Yes, absolutely. In 65. And the concerns there are certainly the broadness in the ability to write a script for pretty much anything that provider thinks that might be good for them. And that I've got a lot of dear friends that are physicians, and I support them 100%. That's been a part of my life from the beginning of my career. But there's always bad actors, and there's always folks that are in many cases, they're really trying to help their patient, but they go a little too far. And that script won't be that hard to get. And then we start compounding that issue along with no restrictions on the number of treatment centers. That is a mistake in our state. And I think it will lead to more harm than good. So if we go forward, and my stand from the beginning is no, for the reasons I stated earlier, I don't think we're ready. Our state's not ready. Let's talk about, and I can certainly do it from a hospital perspective. If we look at the employment and all the employees that we have across the state of Mississippi, how do we gauge what impairment is with marijuana? We don't have that test yet. We're not there. How do we know if somebody is impaired on the highway? Now, I understand there's restrictions in 65 if you get caught, but the issue is how can we control that? And then it's compounded by how do we expect the health department to manage this when it's just thrown on them? There's too many variables, David. The best thing I think we can do is say no, but certainly if we're dead set on having medical marijuana, we need to support 65A, and let's work through this. If we move forward and we put 65 in the Constitution, it is a much more difficult situation when we wake up and say, oh my goodness, we went a little too far. We need to back this thing up. And, of course, you know the process that we have to go through. We have to go through another initiative to change that. The legislature their hands will be tied. They can't fix that. So it will be much wiser in our situation. And you said it great while ago. We want it now. Well, it's not always good for us to get what we want right now. If we can do it the right way and take care of everybody the best we can that is involved in the situation, then I think long-term we're in a much, much better situation.
Well, one thing you said was that physicians sometimes can go too far in trying to help their patients. It happens.
Sure.
Doctors
There's no
are
malice.
human.
No malice.
Doctors are human.
That's absolutely.
That has contributed to the opioid crisis that we've had. That's been a big contributing factor of it.
That it has.
So we have rock-solid proof that it happens, but what do you say to those people that say, well, this will help alleviate the opioid crisis?
Well, you know, that's questionable. Initially, when I first got involved in having discussions about this and about the initiative, there were some studies out that were showing that there were some positive moves from an addiction standpoint and alleviating the opioid issue. Now, if we look long term, those studies have not held. So I have to say it's not the answer. It may be a step in the right direction, but when you're dealing, and I'm not a behavioral expert by any means, we all have faced issues like this in our families. We've got friends, we've got folks that have had to deal with dependency issues, and I don't think moving them from one dependency drug to another long term is the answer.
We've got a text, and the C Spire text line is open, by the way, and Tim will be glad to help me take a run at anything you want to send in. 601-879-4395 from the 662. Somebody says, so how did the lawmakers let the language in the bill get to the point it is now? That's the problem. The lawmakers had no input on this.
Right. I think that was one of the things that there is such a divide in that issue, in medical marijuana issue, that it was one of the things that everybody tried to avoid as long as they could. And it should have been addressed. It should have been taken up. And I sincerely believe our legislature is ready to take action on it if given the opportunity to do that. I have to fault them for not taking action before now, and that is what put us here. That happens. Look, it happens on anything, any issue. If the legislature doesn't move and the people speak up, then that's the direction we have to go.
Yeah, and I'm sorry, but just because it's a ballot initiative does not mean it's a good thing. We have had some initiatives that have led to some good things, in my opinion, the voter ID, some of these other things. But there is nothing that is perfect in this world, and just because it's an initiative is not an argument for it or against it.
I would agree with that.
It comes down to how it's workable. Craig texted back in, we've got several like this, said it's not about I want it now, it's having zero faith in the legislature to produce a fair and productive bill. My response to that is, you think 65 is fair and productive? If that's the goal? Because, Tim, I don't.
Yeah, no, I do not think it's fair from the standpoint of the appropriate controls in place. Again, let me say, I don't want to keep people that legitimately have a need, and I know some of the folks that could actually greatly benefit from this, and I want them to get that, and we all want them to get it as soon as possible, but let's don't do more damage in trying to fix it than we would in trying to do it right the first time. Exactly.
Jeff in Forest County, Mississippi legislature had their chance, the people spoke, prudes. So we get that word a lot from Jeff, prudes. And it's one of those things where it's not necessarily being prudes, I don't think. It's that this is a complicated issue. There's a lot of moving parts to it, and they just really haven't wanted to tackle it.
That would be it in a nutshell.
They have been scared of it. Yeah. And, yes, that is their fault.
Yeah.
They are to blame for that.
And, Dave, I don't think any of them would run from that. I think they would tell you that today, that, look, we should have addressed it, and we did not, and that's on us.
Exactly. Now, this is a good question from Mose, actually, off the beaten path just a little bit. And he even starts it with, Dave, let me throw a monkey wrench into the conversation. If 65 passes and the people who are supposed to initiate it refuse to do so, stating they will not be forced to break federal law, what happens then? In the terms of hospitals, going to your specialty, is that an option? Is that a possibility that could happen?
I think it would definitely end up in court, probably. That is a really good question, and that's a big wrench to throw into the middle of the conversation, because I think that potential is always there for litigation, and you could have some folks that are strong enough in the mindset to say, look, this is against federal law. I'm not going to do that. That would be interesting. That's a good question.
What you just brought up regarding winding up in the courts is a point I've been making, and it ties in with something that Elizabeth texted in from Gaucher. Said, as a 2-time cancer patient with severe neuropathy since 2009, I've been waiting for long enough. I agree with you, Elizabeth, and I feel 100%. But you know what? If 65 passes, minimum, you're 3 to 5 years out from anything actually being done because of the court challenges.
That's very possible. That's very possible.
This, in my opinion, is not the way to quickly get medical marijuana. It's going to get tied up in court. It's going to be batted back and forth. There's going to be more discussions and arguments and fights, and nothing is going to happen for the next year or two. I don't care what the initiative says. It's going to get held up.
If we go with 65A, then there is an opportunity for the legislature to come in and help promulgate some other issues and start doing the policies and procedures and regulations that need to be put in place and done timely as possible. I mean, it's a challenge. It's going to be a challenge.
Tim Moore, President and CEO of the Mississippi Hospital Association, with us. We continue with him next. On to wonder if William and Brandon has like a secret microphone secured somewhere here in the studio listening to the conversation during the breaks. We were just talking about this, Tim. Tim Moore, President and CEO of the Mississippi Hospital Association. William says, what provisions are in place to stop people from doctor shopping, ending up with loads of pot and selling on the street? They're spying on us, Tim.
You may want to do a little sweep up here.
Because we were just having that conversation.
That was it.
During the break, and the short answer is none.
None that I've been able to identify. And in all of our controlled substances, there are tracking mechanisms. Now, one physician may not know that another one has written a script, but when it is filled, it goes into a shared data bank. And I was telling Dave that you may get away with it a couple of times, but it won't be long. And your pharmacist is going to put you on hold, and then you'll be having visits from law enforcement to ask you how that happened. And that could be a major issue with this initiative and a major concern.
Exactly. That's what we were talking about. The only thing mentioned in the language of 65 is that nobody's allowed to access the database.
That's pretty much it.
So the language of the initiative is actually the opposite of how to track this kind of thing. It's saying nobody's allowed to track this.
Right.
That's what we keep talking about when we say that this is problematic, it's poorly written, and has holes you could drive a semi full of weed through, which is exactly the plan.
Well, I as a hospital guy, I'm a big HIPAA guy. Everything we do is centered around HIPAA and protecting information. So certainly there has to be protected information, and rightfully so for putting that there. But you cannot eliminate the tracking. And something of this nature, of this magnitude, that will affect the whole state of Mississippi, I think we probably should be measuring some outcomes. Is it doing what we expected it to do? Are we providing for the patients that need it? Is it effective in that treatment? But there's a lot of reasons to be accessing that data bank and doing analytics on it to make sure we're doing the right thing for the patients.
In other words, there's no way to know the way this is set up in 65 whether or not it's even working.
Correct. That's my interpretation.
That's scary.
Yes.
Have you had conversations with any of your counterparts in other states that have medical marijuana in place about how it's gone for them in the hospital industry?
Very limited. We have had so many other issues going on with the pandemic and other healthcare-related issues that we've really not had a lot of direct ones. Back in the you'll like this. Back in the initial passage of some of these bills, when Colorado moved forward with all of their medical marijuana, one of the comments that I got from my counterpart there was that we got more money than we have ever seen, and that was his comment. That was it, and that's something we need to be careful of. We shouldn't be driving this from a financial standpoint. This should be for the good of the patients, and that's a concern there. When you look through this, is who is actually coming out ahead in 65, and I think we just need to give a lot of thought to that before we go vote.
Well, and I keep coming back to this, and I'm going to keep saying this. 65 is the slowest option to get medical marijuana implemented in the state, in my opinion, because I know what's going to happen. If it passes Tuesday, I know where we're headed from there, and it's to the courts.
Yeah.
And it's going to stay there for years. And during that time, it's not going to be implemented.
It'll be locked down.
And then here's my question. Who are you going to fuss at if you still don't have medical marijuana? If it's 65A and it gets tied up in the court, you can light your legislator up.
That's exactly right.
About what they did. Who are you going to call on this one?
Good point, Dave.
If it goes wrong and we're in 2022 and you still don't have access to medical marijuana in the state, who are you going to complain to? Who are you going to talk to try to get this straightened out and sorted out? You don't have anybody.
That's right.
And that's part of the problem with this to me. The problems, the list is as long as my arm, Tim.
Yes, sir.
With the way this is put together and the way it's implemented. And I would suspect it's going to be a nightmare for the hospitals to try to track this. And from what I understand, correct me if I'm wrong, let's say somebody comes to the hospital and they have a problem. They head to the emergency room. You're not allowed to know whether or not they're using marijuana before you prescribe other drugs or anesthesia or anything else the way this is written. Is that right?
That is my understanding, and I probably need to dig into that a little bit more. But in most cases, if there is a trauma situation, and let's say that the patient is unconscious, then there'll be a drug screen done to find out. You have to know what's going on. Typically, a pregnancy test and on female and a drug screen, because you can't take that chance. Drugs are so accessible that you don't know what may have caused the problem. So I would say that it would be in the right of the physician to get a drug screen and move on. Now, if the patient is coherent and is making medical judgments and they say, okay, we want to do a drug screen, they may say, no, I don't think so. Then they may not get any other drugs either. But
well, that was my question.
Could deny that
impacts the care of the patient.
Absolutely, it will.
At that point, if they shoot that down.
And another concern, I don't think we've talked about this, but the concern of how do we know if our employees are impaired? What is the level? It's just not there. We don't have access to the testing to be able to do that. So and that may be any small business. That's a big expense to try to handle that. We certainly don't want our healthcare providers being impaired when they're at work. How do you? There's just, like we said earlier, there's so much to do and talk about before we just jump into this thing.
Get this question on a regular basis, and I'm going to give it to you because you're the perfect one to ask. David in Indianola, will insurance cover any of the cost for medical marijuana?
In 65, they are not required to. So I think that would probably be a call of the plan. And a lot of folks are not familiar. Depending on the type of plan, it is written a specific way. There certainly may be some situations where a provider would cover it. I'm not going to say they would or they wouldn't, because that would be the call of the plan. The subscriber of the plan would know that, though, from the plan prior to. I'm sure there would be a pre-cert on it.
Yeah, you would think so, yeah. Just for those that might not know, explain what a pre-cert is, but I think you're right.
That would be a prior approval prior to prescription. So the insurance plan would have to say, yes, we will pay for it or we won't, or it would be an out-of-pocket expense.
Yeah, you would have to contact them and say, hey, I'm about to get a prescription for this. Are you going to pay for it?
Exactly.
So an extra step there, but that's already in place for certain other types of care and drugs.
As a matter of fact, I'll digress just a little bit for you because this was interesting. I just got it this morning from some of my counterparts in other states. They're seeing insurance companies now put in place a pre-approval for COVID testing.
Really?
You have to call and be approved before you can get your COVID test.
So is this
I've not seen that in the state now. Let me say that first, before my phone lights up and all of our insurance companies start hollering at me. That is in other states, but we got the call. Have we seen that in Mississippi? And I have not. At this point, I've not seen that.
But that is interesting, and I assume the insurance companies are going to fall back on the same thing that we saw at the beginning when testing was limited. Well, are you running a fever? Do you have this symptom? Do you have that symptom? Before they'll make that determination whether or not they'll pay for it.
I'm guessing. But, you would think the provider would be able to determine that. But anyway.
You're just full of good news today, Tim.
I'm loaded up today.
Yeah, I'm telling you came loaded for bear. I like that. There are just so many problems here. Thomas says if it's hung up in court, the voters will hold the officials accountable at the polls come Election Day. The officials didn't have anything to do with 65. I get your point. Don't get me wrong. You're saying, well, we'll hold them accountable because they didn't
address it earlier
to begin with. And yes, they are at fault for that.
Yeah.
Representative Trey Lamar, chairman of Ways and Means, was on with Paul this morning, and he admitted on the air, he said, I've been advocating for this for years. We need to do something. I don't know why we haven't.
Yep.
That is a reality of the situation. But if we're going to deal with realities, we have to deal with the reality of the way 65 is written and the holes that are in it that are going to lead to lengthy court challenges and a lot of potential problems across the board, I think.
Yeah, I think that's right, Dave. And the way to do that is to go with 65A.
Exactly.
Yeah.
I had someone ask the question earlier, and I'm going to ask you the same question. Because I was making the point that I'm for medical marijuana. Mm-hmm. I think it's a good idea. I think it's necessary. I think it's past time for us to address this.
Sure.
But if I'm for medical marijuana, why would I vote no on the first question and then 65A? So what's your thoughts on that?
Well, I think if you vote no, and for some reason the initiative just completely does not pass, then you've eliminated that, and we can go back and we can get the legislature involved again. If it does pass, in which you and I have also talked about, we're afraid that's probably what's going to happen. But 65A is the best option that we have before us.
Exactly. So it's mitigating risk.
It is. That's right.
We're close to back to talking about insurance again, aren't we?
Oh, let's don't do that.
Tim Moore, President and CEO of the Mississippi Hospital Association. You are welcome back anytime, sir.
Thank you, Dave. It's always a pleasure.
Always
Enjoy
good
being
to
with
see
you.
you.